The cost of drug-involved crimes to Singapore amounts to $1.23 billion in the year 2015. And this economic burden is equivalent to a per capita cost of $316. Now, these findings from an NTU research team were revealed at a seminar called Harm Prevention, where the government, community partners and academia shared research on drug abuse. Ariel Lim tells us more.
The Home Affairs Ministry said the study has shown that the cost of drug-related crimes remains a large and significant burden to society.
What we can say is that just looking at 2010 and 2015 itself, the figures itself, the amount that is currently spent in those years for combating the drug crimes actually falls far short of the cost to society, the overall cost. Therefore, it leaves a lot of room for government to increase spending.
Another study examined the impact of deterrence factors facing people who have considered drug trafficking.
What we found is that they actually went through a cost-benefit analysis looking at the risk perceptions in terms of the laws as well as other factors that affected them. And this was balanced with their own individual personality factors such as impulsivity, their level of criminal thinking, and the situations that they came from.
They found that people would be less likely to traffic drugs if they thought they would be caught and punished. Traffickers who were aware of the penalties also limited the amount they peddled. Rehabilitation is also a key pillar of harm prevention to help drug abusers break the vicious cycle.
Due to the collective efforts of the authorities, community partners, many of whom are here today, and all our stakeholders, Singapore's recidivism rate for drug abusers has dropped considerably from 67.4% for the 1996 release cohort to 24.4% for the 2016 release cohort. It's 40 percentage point improvement over 2 decades. Still, we must not take it as a given, and we really do want to see whether we can find the next breakthrough.
Singapore's approach has worked well, added Mrs. Teo, as the drug situation is under control despite significant deterioration elsewhere. And the government is committed to working closely with its partners to strengthen the evidence-based approach towards drugs.